I'm Lexa Schlosser, the managing editor of A to Z magazine from the AST. And here today I have with me Brendan Duffy and
Hello.
Bretton Hevener.
Hello.
And we're going to be talking about how technology is impacting sleep. So, and either of you can answer either any of these questions. How would you say the sleep care field is different today than it was 5 years ago?
Well, I think that what's kind of interesting, I was just at the recent sleep meetings here in town, and one of the biggest things you could see when you were actually sitting at the exhibit floor, which is hundreds of exhibitors, it used to be that in the center was all the PSG machines from all the manufacturers, et cetera. And this was just last week, and I was looking around this time and realized that there was a lot more on durable medical equipment from the sleep perspective, as well as some manufacturers on pharmaceuticals, but technologies and were being introduced as well.
It's definitely in all places. On the way here, I was reading through Sleep Review magazine, and even oral appliances have tracking capabilities now. So we're thinking about CPAP and looking at how much compliance has changed, that now you could track a lot of the apnea indexes and mask leaks and everything. But when it comes to oral appliances, and the future from what they're looking at is that they want to take those CPAP machines and actually have, quote unquote, a home sleep study built in, so that even after people are diagnosed, they can actually go in and look at a lot more than they're looking at now with heart rate and respiration and things like that.
So a lot more on that is that it's less and less about just diagnosing, but more and more about treating and treating ongoing.
Getting beyond the 90 days, because unfortunately, everybody is used to seeing 90 days, because that's what Medicare talks about, the first 90 days. But the truth is, if people don't keep track and work with people, that they tend to fall off. So if you want the compliance to stay high, you have to have some kind of interaction with the folks going forward after that 90 days.
Gotcha. So how do you, with so much change going on in the field, even in the last probably 2 or 3 years, how do you think that sleep care professionals can best prepare for these inevitable changes? How do they stay on top of them?
I think reading and staying on top of the magazines and literature that's out there. The A to Z has very dynamic and current articles that are coming out. Sleep Review, industry magazines, things like that. Getting to conferences and looking at some of the consumer conferences too, because sleep is a big item on the consumer market now. So the Consumer's Electronics Show has a whole section now dedicated to sleep, which it never used to until the last few years, but there's so much there from mattresses and lighting and wearables that it's something that you really do need to keep track of, because the patients are, and in order to work with them, you have to know what they're bringing to you.
Yeah, what do you think, so much, you see so much of these consumer products and people caring so much more about sleep and understanding, their personal sleep. What do you think it was? Was it did technology come first and then people got interested, or were people interested and the technology followed? You know what I mean?
Yeah, I think that the technology definitely brought about an awareness. That would be the primary on that side. On top of it, you have, because of the technology companies, they wanted to advertise what they had, so they started to recruit spokespeople. So there's louder megaphones out there as well, which brought awareness. So it did sort of circle between awareness and then the technology.
And it's been good and bad, because the awareness of sleep being important is out there. The bad part is when people start to totally focus on it, and they really get too far into it, and they actually cause sleep problems, because it becomes this big white elephant that don't think about sleep, and it will happen, but look at it as soon as you wake up.
Yeah.
And then we tell people not to use technology, but track your sleep through technology. So it's a mixed message that you really have to work with people.
Yeah, people, I guess, think they can get all their answers from that technology, and they kind of forget that there are, real professionals that are, certified to
And it doesn't tell you. Somebody was mentioning, I had a laugh on Twitter this morning, they mentioned that somebody said they have a new technology that will tell you when you're drunk. And none of this technology will tell you things. Your vacuum cleaner won't start speaking. Well, it could, but it shouldn't start speaking to you and figuring out dates for you. It kind of gives you averages and things to look at so that you can look at the information and try and make assumptions of it, but it shouldn't be telling you things.
Can you talk a little bit more about, what are the good things and what are the bad things?
Yeah, sure, the compliance, anytime we can get good compliance information, and hopefully they'll sort that out, because if it is data mining, so who owns that, the DME or the physician? So there's a lot of trouble right now in can we get this useful information, and if we do get it, who's able to get it, and how are you fair to the patient, and things like that. So that is good on the compliance end, for reasons we mentioned, that you want to keep tracking people. The bad part is, again, going back to people that overconsume and become consumed by it, and they have terms for that already. They call it orthosomnia, where they're looking for a perfect sleep. And it really becomes much too hard a process for them, and it's not natural. So that they are actually creating more patients just by these devices.
And Brendan's right. I mean, that type of laser focus on how am I sleeping, that does exist, but that is probably the minority. I mean, we see a lot more attrition from using these wearables, after you get X amount of information and put it to the side. And so one of the best things, I think the biggest pros about these technologies is a way to reach the numerous amount of people that have not yet been diagnosed with a sleep disorder and do need therapy, whether it's awareness, access to care, or just the solution that gets the job done, because our current infrastructure can't handle the number of people that need our help.
Right. And we've been fighting the home test, but they're here to stay.
Yeah.
And they do have a place. They do
definitely.
have a place. And people who really fight against it, it may be the bulk of the testing may be done at home sometime, which is very little people with comorbidities where they really have to be in a hospital setting. But we really need to step up and realize that this is the new sleep model.
Sure.
And it's probably going to get even more compact as we go along.
Is it kind of decided sleep center by sleep center whether someone can do a home test or not? Are there standards for when they decide to give someone a home test versus in the actual center?
We do at our place. We try to, most of the time, we try to get them in because it's a more complete, complex test. I mean, unfortunately, the sleep studies, for the most part, the sleep test that we're using right now, they can still tell you if you're asleep or awake. So a sleep test, at the very least, should be able to tell sleep and wake. But a lot of them don't have the EEG capability, the electrodes. And if they did, then you have a battle as to would people be able to do it successfully at home. So we try to do a lot of ours at home, in the lab, rather. But sometimes the insurance companies are dictating it.
Right.
So they'll dictate and turn down and deny, and then we have to opt for a home study. And we'll do that. And if need be, then we'll go back and do an in-lab study if it's non-diagnostic.
We basically it starts, yes, with the American Academy of Sleep Medicine and Medicare putting a standard out there which says when a home sleep test is appropriate and when an in-lab test is appropriate. From there, the insurance companies will maybe require or mandate with pre-authorization requirements, et cetera. If the pre-authorization requirement isn't there, then it does come up to the local sleep center. A doctor may say, this patient is perfectly able to have a home sleep test. They don't need to be into the center. And so then it's a choice. So there's several levels to determining that. We do all home sleep testing at our center. We don't do in-lab sleep testing. Those all get referred out to local sleep centers. And we are specifically looking at sleep apnea in that case. So it depends upon what your focus is.
Right.
So is there a certain level of margin of error when you do the home sleep test that you have to account for, or do you find that it works pretty well
Yeah.
with your process?
Yeah, you'll have your very milds, maybe negatives that are symptomatic, and you're going to want to make sure that they get into a sleep specialist and kind of follow back up there and really figure out what's going on. But if it's apnea, it's apnea. So.
And that gets back to the data mining, because doing all those home tests, they may see one provider who most of their tests are severe, and they can go back to that person if they have the data and say, are you really screening the full gamut, because maybe we should be seeing more moderate. Or if they're doing a lot that from that one provider are mild, are you over-screening and sending people that maybe you shouldn't? So the data is a big item for this whole piece.
Sure, that makes sense. Okay, so we talked a little bit, you're both on the AAST Strategic Content Committee, and we talked a little bit about this on a call we had recently with that, these little sleep apnea machines that fit in your hand that you can just put on your face. What are your thoughts on these types of products, and what should consumers know about these types of products that you might see on a Facebook ad or somewhere on the internet?
Well, to jump in before you go to
go ahead.
that, it's just there's a definition because we keep saying, the device you can put in your hand. And so there are some legitimate devices that both ResMed, Philips Respironics, and other manufacturers make that are capable of putting out positive airway pressure. Here we're specifically speaking about the one that has the micro blower in it on that side of it. That's the can't quite remember, but yeah, smaller. It's not
Probably
yet
best
developed all the way.
not to say it anyhow.
Yeah.
Yeah, there is one that's been out there for a while, and it was a GoFundMe type of deal.
Right.
And it's a shame because people are desperate for help. So when they see something like that, of course, it looks more attractive than some of the other options. So they will write their check and send it. But it really, it's not something that we
Yeah.
believe is
Yeah,
going to happen with this person.
when you read on the pages of how these types of items work, how those blowers pressurize the air to get that pressure directly to the patient, it's debatable still amongst others whether or not that will work. So the fact that device is going to come sometime soon and be game-changing, it's not quite there just yet, if it is possible. The other question about it is, if it is possible, will it ever be as small as those prototypes actually look and able in order to get there? So it's,
And you can't say
I don't
never
know.
because we've seen things that we didn't expect to see, So maybe I just think that this particular one that shows up a lot is a lot of marketing to it. The machines that Brett was talking about, the ones that fit in your hand, unfortunately, at least by us, they're great for people that want a smaller unit, but they won't cover them for insurance.
yes, they're not PDAC coded, so you can't bill for them as you would bill for a CPAP machine. So they're retail cash items right now that people pay for out of pocket. Some people really like them, some people don't. There's pros and cons, across those, but they do work.
And I saw one yesterday, there's just different devices for very mild, I don't know if you saw Bongo.
Yeah, it's neat.
It's just little inserts into the nostrils, not connected with anything. It's nasal pillows, but longer.
Sure.
And they have vents so that when you exhale, it allows you to exhale. When you inhale, or rather when you exhale, it blocks the valves close. So it sends a backflow and it's supposed to open your airway. So there's different things that are coming out, and some of them may look similar to what we were talking about, but this one doesn't have motors. It's strictly user generated.
Sure.
You are the motor. Yeah, so there's different things out there.
What's, really interesting about it is how much this is something that has changed from 5 years, back to your original question, 5 years, 10 years, are these types of therapies, whether it's a mask, they continue to be innovated when we think that they couldn't be innovated on anymore.
And-
Something new sort of happens with them, some sort of idea. Oral appliances is the same way. There's some sort of new, smaller, sleeker, sexier item,
And we have a bleeping mask now. That's
Yes.
the name of the mask.
What's the
It's called Bleep, right?
Yeah, it's,
I think it was a sleep tech,
I think so, yeah, it
and
was.
he was at the conference hanging bottles. It's a Band-Aid, similar to what I was mentioning about something with backflow, but it's just a Band-Aid with flow circles out of it, and you connect to that. And there's no real mask because it's all sealed within that Band-Aid and the tubing. So he was hanging a 16-ounce bottle or something on it and showing that he could move his head. And I'm not sure who's doing that in their sleep.
Yeah.
Hanging bottles, they may have other issues.
No, it's
But he showed that the tape did hold. So these are people that see the problems that people are having with masks and headgear and everything else, and they're trying to simplify it. They're getting very creative. There's a cloth mask that's been around for
Yeah,
years.
yes.
And for the kids with that cloth mask, they would have it in zebra and elephant, different shapes for the kids that may have to use CPAP. So there's people out there trying to build a better mousetrap.
Yeah, I mean, it seems like, even though maybe some of these innovations aren't exactly hitting the mark or work as well as they might say they do, that the act of innovating is going to get us to an evolved place in the field.
Absolutely, absolutely.
There's even a pill, I think, coming out for apnea.
Yes, yeah,
Really?
we're starting to see some success.
Yeah.
Yeah.
I'm sure people would be much more willing to do that. Always people want to take a pill. So do you think overall that people have more or less sleep issues than they did in the past before the proliferation of all this new technology? Or would you just say it's kind of people are being more aware of it, so it seems like there might be more, or what would you say?
I think it's both.
Yeah,
I
I was
think
gonna
that
say.
I think that as our obesity rate rises, we have more sleep apnea. It's not the singular causation or association, but it definitely has a big impact on that. And that's affecting pediatrics all the way through adults. So that is increasing. When you look at things that the CDC and National Institute of Health put out, they have some things where they start talking about that our sleep debt is rising. And I think that those types of metrics are probably based upon people that have more stress, more insomnia, more demands out of life, professionally and personally, and they're creating their own, sleep debt by not getting adequate sleep.
More technology.
More technology, yeah.
So that's where it hurts on both sides.
Yeah.
But definitely, people are also just more aware as they search for improved overall health at, looking back to themselves and saying, it's not okay to get 5 hours of sleep a night for the normal, average person.
Right.
And Dr. Walker will say that every hour you're awake, you're getting brain damage. You really are. And if you remember, if you used to go shop or wait in line to buy tickets, there used to be free time to just look around, daydream. But we don't have even that time anymore. Everybody on a shopping cart
Sure.
line is there. So your brain is totally worked out, engaged for the full day. And then we're getting the kids to get up earlier than they ever did before for school. So we're starting, again, the obesity, and a lot of that may start because the hours of school are wrong for teenagers who now have a perfect storm of all this technology. So they're staying up with that. They can't go to sleep anyhow because their biological rhythm changes when they reach puberty. But the schools are starting an hour earlier than they used to go. They used to be decades ago. So we're getting them 5 hours sleep when they may need 9 or 10. And the worst sleep, or the most important sleep that they're losing is that last couple of hours, which is mostly REM, which is all emotional and mental. So you're having issues there also. So there's awareness of all the sleep devices, but there's also changes in the way we're living our lives and the foods we're eating and how processed it is.
Right.
It's a total picture.
Have you guys seen more and more platforms and companies are kind of doing the dark screen mode? Do you think that's helpful, or is it kind of a Band-Aid on a, do you know what I'm talking about?
Yeah.
Where that's like, I guess, providing less blue light to you at night. What do you think about those kinds of small incremental changes?
There's a lot of those going on, and some of the literature I've been seeing say it's really not influencing the blue light as much as people thought it was at
Really?
first. Some of the last studies, they're saying unless it's really close up, to your face, that they don't see it the way they used to see it, and they're starting to do studies. So, as much as I used to say, try to cut down on that, just in general, just to stop feeding your brain all that
Right.
information, the arousals. It may be not as big a problem. It's probably still not good sleep hygiene in general, but that's what I've been seeing.
I'm not sure of this specific technology that's going to work, whether it's this dark screen or whether it's, specific eyewear, et cetera, that it's forming. But light is important along the way. And so as we look at sleep medicine as a whole, and we look at individuals and we say, what are the issues that are impacting their sleep, and if we find the people who the light is causing the problem for, we might see better improvement in that specific person. So customizing rather than just generalizing across this population, we're going to put dark screen mode on.
Yeah, that makes sense. Okay. Anything that kind of covers the questions I had on this topic. Was there anything else that you thought maybe would be worth covering on this?
If you're going to, for the CCSH, I think it's going to be important. If you're going to be working with patients, it's not just going to be on the clinical lab, CPAP, compliance settings. It's going to be with a lot of these devices that they're going to be asking, just like you are, same questions. So in order to be the best of what you're doing, you really, really do have to keep up. And like I said, just on this flight over here, I learned a couple of things just from getting time to catch up and reading through a Sleep Review magazine. So if you keep up on the periodicals and the conferences, it will help you get more confident in dealing with the patients you're going to see.
Sure. Well, thank you so much, Brendan and Breton, for joining us today to talk about this. This has been Sleep Spindles.